name is Jennifer Soung. I'm a board-certified dermatologist and clinical researcher from Southern California Dermatology in Santa Ana, California, and a clinical professor at University of California, Los Angeles. I'm excited to be here today at EADV Paris 2025. I'll be presenting this afternoon Maintenance Clinical Response with Icotrokinra, a targeted oral peptide treatment for moderate to severe plaque psoriasis. I was also an investigator on these clinical trials. I'm excited because this is the first targeted oral peptide that is highly effective and has excellent tolerability in a pill. As you know, IL-23 biologics have really excellent efficacy as well as an excellent safety profile. However, still there are many patients with moderate to severe plaque psoriasis who are untreated. And one of the reasons may be that patients prefer a pill rather than an injection. The primary endpoint results were announced earlier this year in March at the AAD, and with much excitement, they were announced and showed increasing rates of skin responses as well as excellent safety in adults and adolescents in the phase 3 Iconic Lead study. Today, I have the pleasure of showing you maintenance of clinical response in both adults and adolescents in the Iconic Lead study. Ultimately, what we see over the 1-year period is that patients who continue ICO 200 milligrams once a day have high levels of response within the 90 percentile range. Adolescents who continue treatment without interruption also maintain high levels of response. Safety is consistent with what we've seen before with targeting IL-23, which is favorable and consistent with what was already published at the week 16. So, malignancy and serious infections are less than 1%. No cases of active TB, which is what we are familiar with, the IL-23 class of medications. So, my 3 key takeaways are: 1, continuous administration of Icotrokinra, 200 milligrams daily in adults, results in high levels of maintenance of efficacy. 2, adolescents who continue treatment throughout 52 weeks also have a robust treatment response. 3, the efficacy is consistent with what we see at week 16 and week 52, and there's no safety signals. So, in the end, in summary, stay tuned. This is going to level up your treatment for psoriasis patients and with high levels of efficacy and excellent tolerability in a pill.